Good morning, dear audience. Our title should be Cancer Prevention in 10 Minutes. You will see that cancer prevention is a rather simple process. In our first talk, we have seen that cancer was going into too many incidence cases starting from the middle of 20th century. It was like an epidemic, and this epidemic was even much more pronounced in civilized countries like United States, Western Europe, and cancer epidemics, cancer incidence was progressively going up in those states. Today in the world, the cancer incidence per year is around 15 million cases, and 10% of this is found in United States of America. The Western world is among the countries with much more frequent cases of cancer. In the Middle East, like Turkey, it is medium incidence, and when you go to the East, Eastern Asia, Southeast Asia, cancer becomes less frequent. Now, what do we do against cancer? When we have the disease, we give treatment. So our first method is treatment. We treat with chemotherapeutic agents, we treat with hormones, we treat with biological substances, and immunobiologic methods. So when you have disease, you treat the disease. But isn't it better if we try to prevent the disease? Then it would be much cheaper and much easier. In order to succeed in prevention, we have to know what are things that cause cancer, what are the causes of cancer. Now, I will summarize you the causes of cancer. Cigarette smoking is about 30% of the cancers, and wrong nutrition, which leads to obesity or more use of carbohydrates, sugar, and omega-6 fats. This wrong nutrition is causing about 30% of cancers. The infections are an important cause of cancer. Bacteria, viruses, and some parasites cause cancer also. Radiation in the environment causes about 3%, and pollution causes about 3%. But there is another group. These are the products of the industry, various synthetics, various farming drugs, pesticides, herbicides, etc. They all, as a group, cause about 20%. We can say that as industry products enter into our life, the cancer incidence is increasing. Just to illustrate these things, I shall show you some examples. This is a graph that shows the sugar consumption starting from 19th century until 1980s. You see a continuous increase in the sugar consumption. And when I show you the incidence of breast cancer in the last 100 years, you see it is almost the same curve. So it shows a correlation between breast cancer in women and sugar consumption in the society. Another example is the nutrition, the effect of nutrition in Chinese women. Chinese women in Shanghai, the cancer incidence age groups, you see the lower columns are women in Shanghai, and the higher columns are the same Chinese women living in San Francisco. The only difference in these two groups is incidence of breast cancer and the way of living, the way of nutrition in San Francisco and Shanghai. This graph shows omega-6 fats and breast cancer. You see these columns are omega-6 and the other columns are breast cancer. Breast cancer goes up in parallel with omega-6. So omega-6 is with sugar the same cancer-causing factor. Another example, another striking example here, we see in the upper part breast cancer in women, and the left party is where the nutrition is animal origin, and here at this end these are vegetable feed nutrition. You see the incidence of breast cancer in countries with how much protein eating, animal eating people in carnivore feeding. You see the breast cancer is much more. The same can be said about prostate cancer here in countries, and these are mostly Western countries. Prostate cancer is very frequent, and why here the people whose nutrition is vegetal, you see low level of prostate cancer. So we can summarize that if you use the Western type of nutrition, cancer is more frequent. If you use Mediterranean diet or Eastern Asian diet, cancer is less frequent. And if you use pure sugars with high glycemic index, cancer is more frequent. If you use complex sugars with whole wheat flour, cancer is less frequent. Also, when you eat organic food, cancer incidence is decreasing, and also some psychological factors like stress and anger, depression are also a source of cancer frequency. My last slide would be the industrial production of chemical products. As industrial products enter our life in the society, cancer, you see this curve shows us the quantity of industrial products, and it is like the curve of cancer increase. Industrial products and cancer incidence are parallel. So we have to take every measure to prevent the carcinogenic industrial products from entering our life. Dear audience, as you see, cancer prevention is not very difficult if we are aware of the dangers of our way of living. If we correct our way of living, cancer will be much less important in our societies. Thank you.